It's time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hi, pet lovers. Dr. Bob from Sylvania Vet. Elanco is one of our sponsors, and I'd surely like to thank them and want to strongly recommend that you consider using Trifexis for heartworm and flea prevention and Comfortis for flea prevention. Once a month flea product, great products, well tolerated, the next generation of flea control for dogs and cats. Sylvania Vet, of course, that's my office, and we sponsor this as well. I try to tell you a little bit about Sylvania Vet each broadcast and brag a little bit. We consider ourselves a regional veterinary full-service hospital. We all have a mental picture of what a hospital is and what it means. We have Flower Hospital, Toledo Hospital. We all know, we kind of know what to expect when you walk into a place like that it's going to be inspected, it's going to be sophisticated, it's going to be clean and hygienic, and there's going to be high-quality care delivered whichever set of doors you send to walk in. That just generally isn't the case in veterinary medicine, and there really isn't a definition of a hospital anywhere in the state law, so that any practice, whether they're full-time or part-time, whether they're only 5 hours a day or they're 24 hours a day, can be considered and call themselves a hospital. So it's just a name. So when you think about Sylvania Vet, we are truly the area's only hospital, because we are there 24 hours a day, 7 days a week. We are staffed for that period of time. We have a doctor available during that time. We provide the full gamut of services. We have highly sophisticated equipment to do advanced care and advanced caring. So we think that that truly makes us a hospital. Everybody else is an animal care facility or it's a clinic, and those are fine. But we're proud of the fact that we provide services that when you put it all together, there's not one other practice in this area that brings everything to pet care that Sylvania Vet does. For us, one of the greatest things is our emergency service. Again, that makes us a full-time veterinary practice. We're your doctor's full-time vet. We're not part-time. We're not turning you over to somebody else should your dog be critically ill. It's not going anywhere else unless it has to go see a specialist. Of course, we're a member of the American Animal Hospital Association, which means that we are inspected and accredited by the American Animal Hospital Association. And if you're not inspected and accredited by the AAHA, then the veterinary hospital is never inspected for standards. The state of Ohio does not provide inspection and which should be a real eye-opener for the pet-owning public in this area. So if you're looking for a hospital and you're looking for a full-time hospital and you're looking for a hospital that has advanced care and advanced caring, there's just absolutely no question that you make the drive to Sylvania Vet at 4801 North Holland, Sylvania, at the corner of Haroon and Holland, Sylvania, because we'll be there for you. You can come take a tour anytime. Last week, I told you, and I know you've been waiting all week to hear about this, but I told you that we were going to talk about a process that happens to dogs, and a lot of dogs seem to have it pretty regularly, and it's called a reverse sneeze. And it sounds like the dog is snuffling up and sucking air up in through their nostrils in a very loud way, and their head is frequently extended and their body is rigid. And it really causes people a lot of anxiety the first few times they've seen it for their dog. Well, reverse sneezing is really caused by a nasal sinus and throat irritation, and that irritation can be caused by anything from getting a good whiff of a lilac cologne to getting a nose full of pollen outside in the grass to many times we can't even come up with smoke. If you have smokers in your family, I would strongly discourage you from smoking in your house. It's certainly not good for the non-smoker two-legged animals, and it's definitely not good for the four-legged animals, both dogs and cats. And so that's another whole discussion. But reverse sneezing bruising is not a serious condition. It really doesn't cause a fatality, but it certainly sounds like the dog is very uncomfortable. In most cases, if you massage their throat, if you change their environment, if they're in the house, you take them out where it's cooler. You go in like a child with croup. You go in, turn the hot, steamy water on, and let them breathe that. That'll settle that down a little bit. And if it just keeps going, then you can do some antihistamines, some Benadryl at 1 milligram per pound will work. But if it's only happening once a week and it's only happening for about 10 or 15 seconds once a week, it's very difficult to justify medicating it. So I would only treat or reverse sneeze if it persists and you keep having repeated episodes on a daily basis. We do a lot of cancer treatment in dogs and cats at Sylvania Vet, and our goals in cancer treatment are different than the goals of the human oncologist, and I think it's important to understand that because our goal isn't the same, and the human oncologist wants to effect a cure, and our goal is to prolong a high quality life, and the difference being is that we don't have to hit the animal quite so hard with medication. As a result, they tolerate it extremely well, and they don't get, in many cases, they don't get sick, and they don't lose all their hair, and all the horror stories we hear about pain and discomfort in people that are having chemotherapy just doesn't seem to happen with the common chemo treatments that we use to treat dogs. I just had a dog in today that went through it must be about 15 weeks ago, we removed a really bad tumor from its abdomen. And we've been through 4 cycles of a chemo protocol, and today we were in restaging to see how we were doing. And lo and behold, this dog is still cancer-free. We are ecstatic. It's weight stable. It's loving life. The family is happy as a clam. And next will be to decide what the next thing is, and we'll be consulting with an oncologist. We generally do that when we get involved in oncology treatment, so that we've got the latest and the best of what's available. And I would say right now that we probably have a dozen dogs and cats at one stage or another of a chemotherapy protocol. And we're very happy with the progress of all of these. They don't always go as well as where we're at right now, but it's really been pretty darn terrific. Recently, we've been hearing in the human news, on the news, about some scares about compounded prednisone that was being injected into the spinal canal and the epidural space of patients with lower back pain. And then the sad news is that a fungus infection got involved. We got fungal meningitis, and a significant number of these people have died, and that is truly sad. It is a concern, I think, that whenever you're using compounded products, they don't have to meet the same standards that the pharmaceutical grade products have, and a lot of times the knockoffs that you get frequently are coming from China or India. Those products are likewise not meeting the same set of standards that the FDA requires. So you need to ask some questions about that. But before you allow a doctor to prescribe or utilize a product on you. I had a question from a client about we use compounded prednisone orally for her cat, and she was worried about that. And the reality is that it was only one compounding pharmacy that was a problem, not the one that we use. And then secondly, we weren't injecting this, but we were giving it orally. So the intestinal tract is a pretty strong protectant against abnormal things being absorbed. And so I assured her that everything was okay with our compounded prednisone, and so we can go from there. One last thought for you on prednisone. Prednisone is a cortisone. We use it a lot in dogs and cats with inflammatory diseases, allergies being the most. And there's one little tidbit that you should know that is helpful, and it's only about cats. If your cat is healthy, any form of prednisone or prednisolone may be used. But if your cat has a compromised liver, then it's important that only prednisolone be used in the cat. So that's, again, the question that you should ask your doctor before he prescribes medication for your cat. Is it okay to use prednisone or prednisolone? Because is my cat's liver okay? So it's time to take a break, and we'll be back on the other side. Hi, well, we got a question recently, and it's really an interesting one, and I'm not sure I've ever encountered this exact situation before. And the question is, I'm allergic to dogs, so I don't go to my daughter's house. I noticed when they come over, I always have allergic symptoms. Is it possible to be allergic to their clothing, etc., because it has dog hair or dander on it? I would have to say that I do think that's a real possibility. Allergies to dogs and cats are really allergies to the saliva of the animal, and not so much the hair, but the hair is going to have, and the dander as well, is going to have saliva on it because animals lick themselves pretty regularly, and cats, of course, groom continuously. So that is certainly a possibility. And I guess what I would do is when they come over, ask them to wear clean clothes, get a lint roller and run it over everybody to see if that might help. And then there's a suggestion that might work for your daughter's dogs and might make it so possible so that you could go even to their home. And that is a product called Ace Allergy Drops. And nobody quite knows why it works, but it's put in the food and it has no obvious effects on the dog. You can't tell they're getting it. It's very dilute, but it changes the allergenicity of the saliva of some animals. And we started this in cats, and there are a number of people that use this, and they're allergic to cats, and they're able to have cats in their own house. And then we've done it on some dogs. I did it for a client of mine who had a bull mastiff with a very slobbery dog, and he was very allergic to the dog before we started the drops, to the point where they were really worried that they might have to get rid of the dog. It made all the difference in the world. So if your daughter were to get the Ace Allergy Drops, put the drops on the dog's food on a regular basis, not just before they come to your house, and then take those other precautions as well, that could very well help. We know certainly people that have allergies, we don't want them letting their dogs and cats in the bedroom or on the bed, because that's really going to put you at risk. So hope that helps you, because I want you to be able to go to your daughter's house, but I want them to be able to have their dogs as well. Just a quick note, on a one-time basis, if you got to bathe your dog and you don't have any dog shampoo in the house, you can use human shampoo and it's okay. But in the long-term use of any of the shampoos from something that you think might be really mild, like Johnson's No More Tears for Babies, or any of the human products, humans and dogs and cats, for that matter, have different skin pHs, and human shampoo, but particularly the drying ones like Johnson's Baby shampoo, are extremely irritating and dry the skin out. They just literally suck the moisture right out of that, and you'll end up with a dog that looks like Pigpen in the Schultz comics, with a cloud of dander following behind. It's best to use a pet shampoo. I really like a product for general cleaning called Plum Silky. It's got a built-in conditioner. We also have a spray called Humalac that you mix with water, and if your dog or cat's a little bit flaky, you spray it a couple times a week. Spray the skin, not the hair. Massage it in with your fingertips, and it's really going to help control a lot of that flakiness. Excessive flakiness, crusty, oily stuff, that could be skin disease, skin yeast, seborrhea, any number of things, and that needs to be examined and diagnosed, and special shampoos and treatments prescribed and utilized on a regular basis. Another thing that can really help your pet's skin and their hair coat is the use of fish oil-based omega-3 fatty acids given as a supplement to the diet, either in the food or as a capsule popped into their mouth. So those are some things that can really help you enjoy your pet and not have them be quite so dry and crusty or as flaky as they might otherwise be. The advent of arthritis treatments has really taken a progressive improvement over the years as we get into treating dogs with arthritis. And we know as that an animal ages, most animals are going to end up with some arthritis. And some of the bigger dogs that are overweight, they're going to get it earlier than we like. And so we always start a whole sequence of treatments, and it's what's called a multimodality approach to arthritis. And once it's diagnosed, I usually like to start with a joint care supplement, either a chondroitin glucosamine product or a product called Duralactin, which I think is a great product. It's an extract of cow's milk, has a kind of a malted smell to it. It's really pretty pleasant, and the dogs really like it. It comes in a chew that the dog, almost every dog will willingly eat, or it's easily crumbled in some food. When you buy foods over the in the store, whether they be in the pet store or the grocery store, and they talk about joint health, the reality is that they aren't adding enough chondroitin glucosamine, and they aren't using pharmaceutical grade product to really make a difference. And so I really consider it more of a marketing tool to just try to get you to think you're helping. And you're not doing any harm, but you're really not doing what you need. So if an animal needs a supplement, then you want to buy that supplement. You want to buy good brand name products. The products that we recommend for chondroitin glucosamine are made by the Nutramax company, and the product Duralactin is available through veterinarians, and we carry both of those products. As it progresses, we ultimately end up with nonsteroidal anti-inflammatories, therapeutic laser, a lot of other treatments. The HydroTub at the Sylvania Vet is one of the tools that we use a lot, so an animal can exercise and keep their joints moving smoothly, and hopefully help us take some weight off, because most of these arthritic dogs are overweight and they aren't active, and so that just makes things worse. Joints stiffen up, they continue to gain weight, and it just makes it worse. But the ultimate in arthritic treatment is stem cell therapy, and it's the newest modality that's available to us. And the best way to do it is through a company called VetStem, and it's VET-STEM. And if you have an arthritic dog and you want to learn more about stem cell therapy that we can provide, I would have you go to their website. You can Google that, and you'll learn a lot. There are some other products on the market where the veterinarian actually processes the stem cells are harvested from fat. The VetStem company, we harvest it, we send it to them, and then they send us back syringes of the product that we know are sterile, that we know contain large numbers of stem cells. The stuff that's processed in the veterinary hospital, there's a lot of concern about the efficacy, the safety. You sure as heck don't want something that you're going to inject in a joint become contaminated. It's a 140-step process in order to process the stem cell process from beginning to end. And there are not many of us that can. I have trouble following the recipe to make pancakes, and so I can't imagine how you would follow a 140-step process in a veterinary hospital with lots of things going on around you, and not having a laminar flow vent to prevent contamination of the products while you're working on it. So thinking about stem cell therapy, I would strongly encourage using the VetStem line and not something else. Another question that always comes up, and I think as we talk about these more sophisticated treatments that are available and the cost that these things have, brings us to the idea of pet health insurance. And I really think its time has come. And there are a number of really great products out there, and I encourage you to investigate it. We have brochures for about a half a dozen companies that we've screened, and you're welcome to stop in and pick those up and start investigating. But I think that at a relatively low cost, I would strongly encourage you to think about pet health insurance for your animals. So should the need for stem cell therapy or chemotherapy or anterior cruciate ligament injury surgery needing to be done, you would be in a position to not have to pay that whole thing out of pocket, but your pet health insurance would pay a large majority of that expense. Right now, those products are far better than the health insurance products that are available to those of us in the human market, which we just got a 17% increase on our office health insurance plan. That's kind of hard to stomach. There's no question about it, but we won't talk politics. So it's time to take a break, and we'll be back. Well, we're back and we're going to wrap it up for another week. And just a couple of things. Early in today's broadcast, I mentioned the American Animal Hospital Association and being an accredited and inspected hospital. If you'd like to learn more about AAHA, you can go to www.healthypet.org and you can learn all about the standards of the American Animal Hospital Association and the 900 different criterion that we have to meet to be an accredited hospital. And you'll understand the difference between hospitals that are and aren't AHA hospitals. The American Heartworm Society is started a program that they call Think 12, and what their Think 12 means is think 12 months a year for heartworm and tag along with that flea. And using the once-a-month heartworm pills, you also get internal parasite control. So you're getting a 3-for-1. That's really where Trifexis fits in because it controls all three of those things, heartworm, fleas, and internal parasites. So there's a really great endorsement for Trifexis through the Think 12 program. Sylvania Vet, we've told you before, and I just want to remind you, is the only practice in the area that is considered by the American Association of Feline Practitioners to be a cat-friendly practice. And there is a difference in the way we approach our cat medicine and our cat surgery, and we try to make it less stressful. Cats suffer a lot of problems with stress, and we're just now learning some of the important ways necessary to try to make it so that it's less stressful and that and hence it's easier to bring your pet to the office. Many people don't want to bring their cat to the office because the cats just get freaked out. So we're working on. We've got a nice handout on how to get your animal ready to come to Sylvania Vet, and how to transport it properly so that it's secure and it's not going to get freaked out. Well, we've got some events to support here and to talk about. And the Sylvania Vet has a memorial foundation. It's called the Memories Live On Animal Foundation. We do a lot of really good things with the funds within there. A Good Samaritan Fund. We donate money to area rescue organizations. We give a scholarship to a student at Ohio State's vet school. I just got a card from this year's recipient of the scholarship, and he was very appreciative. He's from Point Place, so it's kind of nice that it's a local man that has succeeded. He's been out in the real world and decided that where he was at wasn't his thing, and he's gone back to veterinary school, and so I applaud him for the diligence to do that. It's not easy to go back to school after you've been out for a while and you get some obligations and you get out of the habit of studying. But most of the time when that happens, you go back and you're a better student because you've gotten a lot of your wild oats sowed. So it's I think this young man's name is Stephen, and I'm very happy to have been able to help him get through what is an extremely expensive thing in going to vet school. So November the 7th at Buffalo Wild Wings on Central Avenue from 5 to 9 o'clock, we have a fundraiser for the Memorial Foundation. Stop in the office, pick up a free ticket, and come and eat. And 10% of your food bill is going to be donated to the Memorial Foundation. We really appreciate BW3 and the support that they're giving us. That's very generous, and we greatly appreciate that. November 18th, Sunday from noon to 3 is our Adopt-a-thon, and you can come in, see animals from various rescues that are going to be looking for forever homes. November 14th issue of the Toledo City paper will start with the voting for the best of in Toledo will be in there. We're hoping to be able to voted veterinary hospital in the area for the 6th consecutive year. We would really appreciate your support. ToledoCityPaper.com or the paper ballot in their November issues is how you can vote. And please follow all the rules so you do it right. And then December the 2nd, we have Santa coming from 10 till 2 for Santa Pet Pictures. We're going to have a lot of fun with that. We always have. This is our 22nd year, and the cost is $22 per sitting. Thank you, Elanco, Trifexis, Comfortis. Thank you, Sylvania Vet. Remember, there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com and Dr. Bob will answer them on a future show.